So good evening all. In the next few slides, I will be presenting my work evaluating tacrolimus and interferon in cases of vernal keratoconjunctivitis. I have no financial interest. VKC is a commonly encountered disease. Basically, is a self-limiting disease, but certain situations we have certain cocktail of the pharmacological agents which are needed for its management, including steroids, which are needed sometimes to be given in long term, which has inherent side effects like cataract, glaucoma, and secondary infection. But even after so much of medical options, we have some set of patients which do not respond to any of these pharmacological agents, which we call recalcitrant VKC, for which we have another class of drugs called immunomodulators, basically comprising of cyclosporine and tacrolimus ointment in different strength. And past few decades have investigated these drugs and and tacrolimus especially has found its role in a clinical management of such patients. But the problem is longer duration of treatment and withdrawal effects. As soon as we withdraw these drugs, the symptoms reappear. So newest member in this category, which is now investigated, is interferon alpha 2b. So we have also tried to evaluate and compare the efficacy and side effects of tacrolimus with interferon in patients of recalcitrant VKC in a prospective non-randomized comparative clinical trial from March 22 to August 22. Verbal children with active disease who were not responding to disease were included, but those with any coexisting ocular disease or any systemic disease except coexisting allergic rhinitis or any hypersensitivity were excluded from the studies. After getting ethical clearance, all the drugs were discontinued for a washout period of 2 weeks. Basic ophthalmic workup was done when the total subjective symptom as well as sign score were scored, and then the patients were assigned to one of the two groups. Group B was preferably given to the patients who had facility of cold chill maintenance. Follow-up was done by 2 weeks, 4 weeks, 6 weeks with drugs, and after withdrawal of drugs at 8 weeks. Main outcome measures were total subjective symptom score and total objective sign score, with secondary outcomes like side effects or recurrence of symptoms or signs. Classical method of grading by Blake et al. Was utilized for grading of the symptoms and signs, and grading of 0 to 3 was assigned depending upon the degree of severity. Similarly, adverse effects were also graded. Now coming to the results, a total of 32 patients were analyzed, 16 from each group. Male predominance was seen in both the groups. As far as age and duration of disease was concerned, both the groups were comparable. Tarsal variety of VKC was most commonly observed in both the groups. Total subjective symptom score and total objective sign score at baseline was comparable in both the groups. There was a consistent decrease in total subjective symptom score till the patient was on treatment. After the withdrawal of the drug, it was seen that the subjective symptom score showed upsurge in group A, while that symptom score was maintained in group B. Similarly, total objective sign score showed an upsurge after withdrawal of the drugs after consistent decrease with treatment in group A, and it was maintained in group B. There was no significant side effect in either of the disease, for which we needed to discontinue the drugs. Coming to discussion, as I said, interferon is recently investigated in cases of VKC after its established role in the treatment of OSSN, and very handful of literature is available. Starting from a case report, Turan et al. Was the first to evaluate it in cases of 12 cases of for 2 months, in which he found that treatment was safe and effective. Janjani et al. Has evaluated different strength and formulation of tacrolimus with interferon, and has concluded that both the varieties are effective and appear to be safe. Most recent study in this category is that done by Gupta et al. They have investigated tacrolimus ointment with interferon 1 milli international unit, but the study design was different, and they have even concluded that interferon has greater improvement as compared to tacrolimus, but in our study we found that both tacrolimus and interferon were equally effective, but it seems that the later seems to have more sustained effect in patients with recalcitrant. But the limitations of our study is short duration, non-randomized study design, and smaller sample size. But still, it has aroused a ray of hope in such patients, and it needs further larger randomized control trials with different duration and strength, and obviously economic considerations has also should be taken into consideration. Thank you so much.